I'm still looping Win by J-Rock from 7 years ago. And I'm pretty sure that this J-Rock is not a real person. And I feel like this song might have been generated for me yesterday. I never heard it before. It's so good. It's so fucking good. And I never heard it before until yesterday. So I'm gonna be a vet and I'm gonna say this was made approximately yesterday. Anyway, every country has to have dozens, if not hundreds, of very, very senior doctors. You know, a doctor in his or her 40s. There's a lot of education bullshit, indoctrination. I don't know, but like a lot of countries, especially like shithole countries, and China also. Not exactly a shithole country. Parts of it are shithole, but parts of it are not a shithole. And they have very good hospitals. I remember having pretty good experiences at Jing'an Hospital. I would walk in. The first time I went, I had to get a card. I had a sore throat, probably from a nigger bitch. A white nigger bitch. A white, Irish, and or Japanese Catholic cunt that was pretending to be Chinese. And she might also be my cousin. And that doesn't seem very Christian. I no longer recognize Catholicism as Christianity. I don't know what that is, but it's a bunch of trash. Anyway, so I had a strep throat and a fever. I could barely walk. I went to Jing'an Hospital. I got a membership card. They just they gave me a card for like my medical history in that hospital, I guess. And it cost 10 renminbi. But I only had to pay that once. And then they pricked my finger to see if I was allergic to any antibiotics. I waited 30 minutes. I spoke to a doctor. The doctor looked at me, whatever, and then pointed to a dictionary with the Latin, I guess it was a Latin dictionary with the name of the thing I had. She gave me a prescription. And then I got a 3-hour useless IV drip. But whatever. The prescription worked. And it cost the last time I remember I went would have been late 2014. I think it cost me 370. 350, 370, something like that. It was 370 renminbi. I walked in, I showed my card, they did not prick my finger. I waited 30 minutes. I spoke to a doctor, I got a prescription. My girlfriend did not give me the prescription. I just got the IV drip. I went back downstairs with a 43 degrees Celsius fever. I was shaking. They put me on a gurney with ice packs on my head. I saw the bright lights on the ceiling and I thought I was gonna die. And I felt relieved actually. Oh fuck, this is it. Anyway, but I didn't die because of competent healthcare in a Chinese hospital. Now all you need is well, Google demoed this, a phone call translation. Maybe you can do a video call translation. You could even do this over text if you want text support from a doctor. And the reason why it should be, let's call developing country. It's because I don't know how to explain it. These people are experts in giving medical advice to poor people. They will give you a prescription for something that costs less than $5. I've been buying deworming drugs. I don't know if they're real. I think I'm buying it from some former colleagues who hate me. But the worm seems to be dying. I killed a bunch of worms. I had like a massive headache. I felt something dying in my left eye. There's still one in my leg. Big one. But it used to go down to my ankle. Now it's just a few inches in my thigh. I've also been boiling it in the shower. I think I got most of them, but I still have a big one left. It used to be almost 3 feet long, 2 feet long. But now it's just a few inches. Anyway, video call with translation to any language, and trusted network of pharmacies. There is a country that would throw in a few doctors who can see what they can do through a fucking webcam. Every webcam is at least 720p by now. Front-facing camera, I call it a webcam. It's a webcam in my phone. That's the front-facing camera. Now they have ones that are 60 megapixels. Wow. On a webcam for video chat. But, you know, what can an expert doctor do with 720? Like, can you look at my throat? Can you see this? I don't have a throat infection. I don't have a sore throat right now, so it's fine. If you didn't see anything. But, you know, the doctor can maybe have an ability to snapshot the video when it's just in the right angle, snapshot it, and oh, you know, can you do an eye exam in 720p? And again, you have like a guild, a Better Business Bureau network of pharmacies. They don't pay very much to be a part of it. It's mainly just like you ask their customers if they got the right meds and it worked. If they have a good rating, probably do this really cheap. Really fucking cheap. I'm telling you, these shithole countries. Cambodia, for example, they must have I don't know how many people. Like Phnom Penh seems like a pretty big city. There has to be at least 1 million people in this country. Maybe 10, 20. They must have 1,000 veteran doctors that worked in the emergency room for many years. And if you recorded all of the inputs and the outputs of these really, your best fucking doctors you've got, you take the best ones and you give them a desk job. Okay, you're just gonna talk to people through a fucking webcam all day. You're gonna be sitting at a desk in a, like I don't know what it is, but like a Chinese hospital has a certain feeling of cheapness or lack of aesthetic. Government issue. We didn't paint the emergency room pink to make you feel chill. We don't really give a shit about your feelings. This is a government issue hospital. You know, like a shitty communist kind of an office, right? And you're having a conversation with a patient. You record the inputs of the patient. You record your outputs as a doctor. And then you do 1,000, 10,000 interactions. Maybe you can also track your patients, like call them back a few days later to see if everything's cool, how's it going. You track patients. You track 10,000 patients. This is like a nigger call center automation technology. You have a CRM and you track your patients, track their health. Maybe you know what, maybe you do care about their feelings, but you're still in a shitty office. You know? And and again, they can call you whenever they want, and you also call them back. But you don't call them back if there's no problem. It's just you call them back until the issue that they were complaining about is resolved. And they say it's totally resolved, and you say you can call me back anytime if there's a problem, if you need anything else. But like, as of the point at which you sign off that this issue is resolved, you stop calling them. But you do this for 3 years, 5 years, tracking 10,000 patients, keeping the medical history. Maybe you have a team of doctors, and sometimes you pass them around like bitches. Your patients, I mean, you pass them around, and but you have the medical history, and you also have the video call history. What was prescribed? You have all that. You have a chart. You have their whole fucking file. So you can pass around patients. Maybe I want to ask for a second opinion. And again, you record all of the inputs and the outputs of your CRM, your healthcare CRM. And then you automate those, your best of best doctors. You just automate them. They have the ability to refer you. They can definitely recommend over-the-counter medications. They could also ship them. Nigger countries shipping drugs directly to your fucking door through automated doctors. Providing really excellent telemedicine for free. Basically, it's the trusted network of pharmacies that are going to be making money off this. we just covered that you can ship your own fucking drugs. You can have your trusted network of pharmacy. You have wholesalers. You have your trusted network of wholesalers, suppliers. India, China, wow. India has English speaking doctors. See, it's a very, very communist thing to do. If there is really a communist country, or a country that aspires to be classless, to respect the inherent dignity of all human beings, and blah blah blah, spirit of brotherhood. You'd really fuck over the bullshit healthcare network. There is a military industrial complex and there is a healthcare bullshit industrial complex. Maybe Americans are sick of getting ripped off by these Jew niggers. Maybe American people should do this. Maybe some libertarian should take the time to recruit 10 excellent ER docs. Oh, you know, with a 720p camera, I'm sure you can up-res it with an algorithm. You could get a 4K, you could really crop in. Anyway, somebody should do that. Mark Cuban, nigger. That's for you. That's for you. That's for you. You get doctors. You get a nigger supply chain from some country. You find factories that actually make shit that works. You provide the doctor. You have over-the-counter. Basically, you put you power a pharmacy by an ER doc. They can recommend gear. You could sell a smartwatch, a cheap smartwatch. Maybe it's not a smartwatch, but just a fucking rectal thermometer and a heart rate sensor, blood oxygen sensor. You can get most of that data from a smartwatch, but anyway, you sell some devices for measurements, a cheap one. You can be the OEM, motherfucker. Cost plus 15%. So you get a supply chain of thermometer watches with heart rate sensors. EKG. Oh. There's a Japanese company that says they own the blood oxygen sensor. You can rip them off as well. Or I don't know, do they have a factory? Everything I work on is open source, you know, all this IP shit. Like, do they make a watch? Do they have a competing watch? Anyway, it's just like whatever you figure it out. You maybe there can be a rectal blood oxygen sensor. It doesn't work the same way, so you don't have to infringe on their bullshit fucking patent. I don't give a shit. As long as it is built at a reasonable price and your markup is the same as your markup on your prescription drugs, which I believe is 15%. If you're reinvesting that markup into marketing for the purpose of growth, well, Coke spends 30% on marketing, so that's not bad. That's not bad. I'll pay for your commercials. I'll pay for your commercials. If you sell me electronics for health measurement with a tele-doctor that I can also use as a pretty good camera in my day-to-day life, at cost from manufacturer, like it's the same shit that you're doing right now. There's a bunch of factories that make stuff, and then there's an added step where you send it to Foxconn and they put it in a box for you. So you have to call all the fucking factories. You could also just call Foxconn. I want a device of this type that does these things. Really cheap. Really fucking cheap. As open standard as possible. Open source operating system, open source open instruction set architecture, transparent, cost plus 15%. Yeah, do it. Do it. Do it. You can automate your bureaucrats to maximize how much you can spend on your commercials. Commercials can all be AI generated, so you should get a lot of fucking commercials. Out of that 15%. You should be able to go really fucking far. You're not paying K-pop hookers. because you can generate videos of them without their consent. So you can spend a lot. You can go really fucking far. You can do all. You can have amazing fucking commercials. You can invent generic brown bitches. You can invent generic brown bitches and mm, mm. That's a Mark Cuban idea. You know, find 100 good doctors and make them track 10,000 patients each. That's $1 million. Yes, yes, it is. It's $1 million for 1 year. Your customers through your fucking website. It's a web app. You use web RTC, real-time communications, built into the Chrome browser. Doesn't work on Safari. You also can have your own browser that you download on your website. You should be able to put a browser in every app store. And then you have web payments in your browser. So you don't have to pay 30% for in-app purchases. Or you can just use Chrome. Maybe other Chrome-based browsers. Maybe Firefox also has WebRTC, I'm not sure. Anyway, you can sell electronics for healthcare purposes with 15% markup. You could automate Jew nigger doctors that sell bullshit. So disruptive. You know, why don't... Oh, Mark Cuban is not gonna doge the healthcare industry because he's a liberal. He's probably a fucking Jew, that faggot. But you'd really help a lot of people if you did that. It's right up your fucking alley. It's right up your fucking alley. Telemedicine with automated doctors using training data from the best fucking doctors you can find. And you aggregate the doctors. You have 10 doctors for every patient, so maybe you're not tracking 1 million people. You're tracking your customers, as many as you can. You hire as many doctors as you need to. Using 7% of your margin, 7.5%. You spend 50% of your 15%. which is 7.5% on doctors, and the other 7% on automated marketing with good-looking generic brown bitches that speak English with a British Indian accent. They say shit like, isn't it? Isn't it? No? You automate the doctors after 5 years. Or as soon as you can. As soon as you can. And then you spend your 15% on AI generated bullshit. You double your marketing budget as soon as you automate the doctors. You have to recruit doctors that are truly communist, like the kind of doctors, some, white savior type people that go to Africa to give away free medical care. Maybe some Monica Bellucci missionary type, I don't know. Anyway, you figure it out. Like Cuban doctors, Mark Cuban, you could get Cuban doctors. There's a great TED Talk about Cuban doctors. You could get Cuban doctors. Oh, I'm sure there's a lot of Cuban doctors that might want to participate in this. You find the doctor. There has to be doctors that want to do this, not because they want to hurt their colleagues, but because they understand that there's corruption in the healthcare industry and they just really want all human beings to have access to healthcare. There has to be doctors who just want all fucking human beings to have access to healthcare. So you find the best ones amongst them. You put them on a fucking CRM and you automate all of their inputs and outputs. You automate all of their outputs using recordings of their patient inputs. But I don't know, like I feel like China might also want to do this, especially even if you do it, they might also want to do it just because like it's right up their alley to be communists. And I can tell you they have competent doctors. They have competent doctors and they have medications that work. I'm sure. Positive. 100%. In fact, in some cases, it seemed like they had exactly the right medication for exactly the fucking strain of strep throat that I had. They gave me a pill that made my fever go away in 45 minutes. I was fine. My throat was still a bit sore, but not nearly as much, and I was totally fine. It was amazing. It might have also been the ice packs they put on my head, I don't know, but feel like they might have had intel on what nigger bullshit I was given before I showed up to the hospital. Anyway, I don't know if you can automate that, but see what you can do with a webcam, bro. And also electronics. At 15% markup. You can just call Foxconn. All you need to call is Foxconn. Or, competitors to Foxconn. I'm sure there's other people that do what Foxconn does. I only know about Foxconn. A Taiwanese company with lots of factories in China. You can set up a new Foxconn if you like. You should call more than one Foxconn. Call all the Foxconns. Have them compete with each other. And just get the best deal. Charge 15%. I feel like the Chinese are gonna charge less than 15%. I feel like Xiaomi might wanna get in to the healthcare industry. Oppo, maybe there's an opportunity to humiliate you niggers coming from Oppo. Renault, Naughty F. For $350. But I was thinking of you, Mark Cuban, just now because I realized you're doing some of this. Somebody somewhere can, and again, you're just going to be competing on markup. Can we get your since you can go so fucking far with AI generated bullshit for your marketing, maybe we don't really need you to have 15% markup. There can be competition in your 15% markup. Maybe there's another provider that's happy with 5%. They really stretch out their budget. They're super efficient. And they have a really good growth strategy where they reinvest their 5% markup more efficiently than any other company in history. Reinvesting their peanuts. And growing steadily, acquiring new customers. They just focus on their reputation. They never fuck over their patients, no matter who it is, no matter what. because they understand that in 20 years they're gonna have a really amazing fucking data set. You know, like that. Like that. Long term thinkers over short term niggers. Yeah, I feel like I definitely want to pay for your 5% commercials. Absolutely. But there's an opportunity for Mark Cuban because marketing and doctors, I mean, you got a big budget with 15%. Initially, 15% is a reasonable markup. But maybe as you automate all your shit, you know, in 10, 20 years, you have almost no markup because it's all automated. You can set up a benefit corporation that says that you are currently for profit, but once everything is automated, you're gonna open source it. But you reserve the right to have a discretionary budget for your entertainment since you're managing this whole operation. So it's reasonable. A little bit of, you know, salary while you're running this bitch. 150K. Do you have any idea the quality of doctor that you could hire out of a nigger country for 150K a year? Fucking 75. 75. ER docs in Cambodia don't make $75,000 a year. I'm sure. Not in a public hospital. In this private bullshit hospital that I went to, in these nigger hospitals, maybe. But it was empty. There was nobody there except people I knew. The hospitals were completely empty. I seem to be the only person willing to pay for evidence that they are a fraud. Anyway. Automated healthcare through a webcam for any company that has an operations team. If you're already coordinating with factories, suppliers for electronics, very easy to get the very same people as you're automating your operations team. Remember that. Don't delete any of their emails. Record all their phone calls and don't delete any of their emails. You make them work through your CRM. You record everything on the back end. Fuck 'em. You plug them all into your ERP and then you record everything on the back end. Anyway, eventually the markup goes to near zero. You know, I was listening to Jeffrey Hinton and he's terrified about AI. Jeffrey Hinton should be terrified about AI because he's a faggot who drives a Prius. That's why he has a Nobel Prize, because he's a Jew. Larry David, nigger. I almost got run over by a Prius yesterday. I was listening to a rap song telling bitches to get out of my fucking way and some faggot tried to run me over with a Prius. And Jeffrey Hinton is terrified about AI. He says he invented it, but he didn't. He's just a faggot. And anyway, this faggot is terrified about AI because it might kill us all. No, what AI is going to do is it's going to bring markup to near zero while also reducing prices throughout the supply chain. AI plus free market libertarianism. I also I want to coin a new term. Libertarianism is libertarianism is the notion that truly free markets with truly free competition will produce communist outcomes, socialist outcomes. They will AI plus free markets equals less markup, less bullshit, better quality, and just-in-time delivery. Yeah, that's libertarianism. Libertarianism is the Chinese idea from Deng Xiaoping. It doesn't matter if it's a black cat or a white cat as long as the cat catches the mouse. That was in reference to capitalism. If capitalism can lead to socialist outcomes, then fuck it, why not? Who gives a shit? Libertarianism is basically that that's AI plus free markets equals libertarianism. Leading to a classless society where everyone has access to the same technology and everything is super cool. But we don't really use tech that much. Some droids. We mainly maybe before we get traumatized, we just chill, bonfire, whatever. But if you get jaded, you can fuck a cyborg, and she won't cost very much. She'll be really nice to you. I'm gonna go buy some cigarettes after this monologue on healthcare. Have a nice day.